Good morning, good afternoon, and good evening to everyone from around the world. My name is Joseph Wong, and it's my privilege and honor to be a part of the Reach Alliance and to introduce to you the next Fireside Chat. Before we begin, however, I'd like to acknowledge this land upon which the University of Toronto operates and the land upon which we as settlers have the privilege to both live and work. For thousands of years, it has been the traditional land of the Huron-Wendat, the Seneca, and the Mississaugas of the Credit. Today, this meeting place is still home to many Indigenous people from across Turtle Island, and we are grateful to have the opportunity to live and work on this land. We also understand that people are joining us today from around the world, and we encourage you to acknowledge and reflect on the Indigenous territories that you occupy. The topic of the next Fireside Chat will feature two phenomenal leaders here in Ontario. The topic, of course, is Operation Remote Immunity, which was an effort, in an ongoing effort, to ensure the equitable delivery of vaccines to remote Indigenous communities in Northern Ontario. I think importantly as well, Operation Remote Immunity is a reminder that the Sustainable Development Goals are a global agenda, and that we here in Canada, and that we here in Ontario, must be reminded that it is also an obligation for all of us to carry out, not only in other parts of the world, but here at home as well. ORI, from my view, is just an extraordinary initiative, one that on one hand is about logistical mastery, and we'll hear a little bit about that. But on the other hand, I think even more importantly, it's about building trust and overcoming the barriers that have historically marginalized communities here in Ontario. So we are very honored, very privileged to have the two architects in my mind of this very successful program. First, I'd like to introduce Tien, Dr. Tien, who is the president and CEO of Ornge, and is also the chief of the vaccine rollout here in Ontario, and one of the chief architects of Operation Remote Immunity. And it's with tremendous privilege and honor to also introduce to you Lynne Innes. She is a member of the Moose Cree First Nation. She is a lifelong resident of Moosonee. She's a registered nurse, did her graduate training in nursing as well, and is also the president and CEO of the Weeneebayko Area Health Authority. I'm going to now turn it over to Homer and Lynne. Over to you.
Thanks very much, Joe, and good morning and good afternoon to everyone. I just wanted to set the stage a bit and just say what a great opportunity it is to be here with Lynne, because when we were planning for Operation Remote Immunity, it was all virtual. And actually, I don't think it's been such a whirlwind of a pandemic that I don't think we've actually really sat down for any length of time. This may be the first where we can actually reflect a bit on that mission and what we have done. Lynne, did you want to say a few words? And then I'll set a bit of the context of ORI.
Sure, thank you, Homer. So happy to be here. So thanks, Joe, for welcoming and inviting us down to speak about this very important initiative that not only was successful in our own backyard in Northern Ontario, but we can adopt and see these practices and rollouts throughout the not only the country, but as well as the rest of the world. Thank you.
And I think just to set the stage a little, for those who really aren't aware of the scope of Operation Remote Immunity, it was a program that offered the COVID-19 vaccine to the residents of 32 remote First Nations communities in Northern Ontario. And it took place from about January 2021 to April 2021. And just to remind people, the vaccines were approved in Canada just in mid to late December of 2020. And it was quite the thing for the remote Indigenous communities to be first in line for those vaccines. And they were prioritized, I think, because almost all of them are only accessible by air only. They have crowded living conditions and very few facilities for isolation. And there's challenging access to healthcare services if someone got sick. And it was a little intimidating, I think. It happened during the winter over a geography that spanned over 500,000 square kilometers to communities that bordered the Hudson Bay and James Bay area. And on a personal note, I just wanted to say that I was honored to have Ornge and myself be chosen to be the external partners in this mission with Indigenous leaders like Lynne. I immigrated to Canada as a child, and it's only been lately that I realized that many of the benefits and successes that I and a lot of other Canadians enjoy have been at the expense of the Indigenous people. In my eye, ORI was an act of truth and reconciliation. It was an opportunity to say to Indigenous people that they should be first in line to receive this very important vaccine. And so with that in mind, I was actually very, very nervous because all of these things were rattling around in my head when we were asked to make this happen. I'm wondering, Lynne, if you were at all nervous at all. It didn't seem like you were nervous when we were speaking on the on Zoom. And but in your mind, what was at stake for your communities? What did this vaccine mean to you and the proper rollout of it?
So in the beginning, I certainly was extremely nervous because, this was a huge rollout happening in our region and for our people, and having that opportunity was huge for us. And we knew at that time in our toolbox there was very, very limited tools to utilize, and having the vaccines available and in our region for all of our communities was very impactful for survival, as well as being able to manage and mitigate the pandemic as it rolled out, because there was a lot of unknowns in the beginning. However, I was equally as excited to be able to bring the vaccines to the communities to ensure that anybody that wanted them had access to them right away in comparison to the rest of the country and province.
Absolutely. And a lot of these things were going through my mind as well. And, one of the things that I'd heard from, I think, yourself and a lot of other Indigenous leaders was the worry about vaccine hesitancy. Um, I think I'd heard that for influenza, that the uptake in the communities was sometimes as low as 8%, 10%. And there was a real fear that even if we got up there wouldn't be that much uptake. How suspicious do you think the communities were of ORI when we first started talking about it and planning for it?
I think there was a lot of suspicion, a lot of hesitancy, just given the trauma and the history with Indigenous peoples, as well as everyone in my homelands. As you know, I'm a member of Moose Cree First Nation and was born and raised there. So there was a lot of past trauma that we needed to be able to work together and work through with our leaders and our elders, as well as our healthcare experts and advisors, to ensure everybody was getting the right information and to ensure that Indigenous peoples were not guinea pigs for this trial.
And I actually didn't realize that there was this history of experimentation, and that was one of the things that shocked me going in, that there was this history of, I think, medical experimentation. How much do you think that was weighing on people's minds when the vaccines were rolling out?
I think because there was so many residential schools within our region, the largest one being St. Anne's in Fort Albany, there was a lot of hesitancy, a lot of questions. But having the opportunity to meet with leaders, as well as to have the information translated into the local language in the appropriate dialects, as well as the means of communication that we had, not only with the First Nation leaders, but the health directors and all of the community members through social media, through radio talks, etc. I think having the information given to them in their own language made a huge difference in this success.
And I think when we went into this, the one of the bits of advice that you gave, and you gave a lot of advice, and I was very thankful for that, was about the importance of, I guess, involving the community and involving the leadership in everything that we did. And I remember, and this happened over the holidays, like every day, instead of turkey supper or whatever it is that we like to celebrate with, we were on a Zoom call with the different community leaders and the leadership of the communities themselves. How important was that, do you think, to achieving buy-in and success?
I believe it was the huge part of why we were successful. It was very imperative that we reached out and engaged with all of the First Nation communities and built a plan tailored to their needs, because they know what their people needs best. Being a consumer of my own healthcare and growing up and living in the region also played a role in ensuring that we were setting ourselves up to be as successful as we possibly could.
And the questions that they asked, I think, it really reflected some of the fear and, I guess, colonization history and systemic racism. I guess, did you think that we were able to quell some of those fears, or do you think it was an ongoing effort? Like, it obviously didn't stop at our conversation with them. Do you think it continued on into the communities when we arrived, and how did you manage, I guess, that ongoing dialogue?
So I think having the opportunity to be able to have those discussions with the First Nation leaders and the health directors in the community generated a lot of discussion amongst other community members, as well as the First Nations talking to each other, sharing experiences, etc. And having buy-in from key stakeholders was also part of the success, as well as elders. Because in our culture, we look towards the leaders, we look towards the elders to kind of guide us, especially when there's so many unknowns. So having the scientific evidence and the appropriate communication tools to ensure everybody understood what we were doing, and we gave everybody the opportunity to access healthcare or to access the vaccines right in their home community. And I think that's huge, is having access to health care and opportunity as close to home as possible.
And I think one of the other parts that I was quite nervous about was the idea that, from the Ornge role, we were supposed to organize the planes, an external team to go into the communities to offer the vaccine, and that leaders like yourself asked for cultural competency training. How important was that? It was, from my point of view, these were people coming from Southern Ontario, and I was nervous that they would do something untoward or be culturally insensitive. So that was an important part in my view. Did you think it was important? And when you met with them in the community, did you think that the training made a difference?
I think the training made a difference because it made everybody knowledgeable. It gave everyone the education coming into our homelands, the education and the knowledge that they needed based on history and what cultural practices were, and to make sure that everybody felt safe. Made a huge difference. I think it also helped that we had local team members to ensure that everything ran as smoothly as we possibly could.
Yeah, and so that was the other big part that was a challenge for me, which was, I think, to show respect to the community members. We had to arrange for funding for the community members that participated, and it was a matter of taking a proposal and asking the federal government for funding for this. But I thought it was worth it, and I think your advice to me was that this was an imperative, that that our that we needed community coordinators, we needed people in the community involved. What was your sense about the enthusiasm in the community for participation in that? Like, were they really looking forward to it? I know it was a lot of work for them.
It was a lot of work, but everybody prides themselves and, doing the best that they can for their community. So there was a lot of volunteers, there was a lot of enthusiasm. There was no, we didn't starve, that's for sure. There was tons of food that was made by the communities to take care of the team while we were there. providing all of the vaccines. I personally went to every single vaccine rollout for the first set, just to make sure that everything went okay, and I had peace of mind.
And I was very thankful because, as you know, in different communities in the north, there's fewer intrinsic health resources and human health resources in the communities. I think the great thing along the James Bay coast in your communities is that you actually have a robust healthcare system with healthcare personnel. So I think it was very helpful on planning to have your nursing staff, your paramedics, some of your docs going into the communities. What was the sense from the community members when they saw your healthcare personnel as part of the teams?
So I think there was an additional trust and comfort once they saw, the familiar faces that generally travel up and down the coast, as well as having two of our local physicians, Dr. Innes and Dr. Turner, accompany the vaccines. I think that was a huge, settling and anxiety reliever for many in the communities, to see that, we had not only received the vaccine, but we were there to bring information as well as to give the vaccine.
Yeah. One of the things that really surprised me was, and what I was quite nervous about, was developing the schedule for communities. So as I mentioned, there were 32 communities, and based on the limited availability of people to go in for teams to go in, I sort of calculated that we only could do 6 teams at once. And I thought, boy, there's going to be a lot of clamoring about who goes first, as sometimes there is that I noticed later on in the South. And I was so surprised that, the communities were so receptive to the schedule that we presented, and no one sort of said, I need to be first. Why do you think that was the case?
So I think there's multiple reasons for that. Initially was both yourself and I met with all of the chiefs in every community, as well as the mayor of Moosonee, to ensure everybody was aware of the plan and how we decided we were going to move forward. So choosing the community that's furthest away from our hospital with the least infrastructure and healthcare capacity and resources seemed like a very reasonable and common sense approach. And everybody respected the decision and supported the decision. So I think that's why it went well. As well as our time frame. We shortened up our time frame. So instead of spending a week in a community, we would spend a couple of days in the community and try to get as many people vaccinated as we possibly could. And then we'd move to the next one, and then always have the contingency plan to get back if there was weather or if there was another group of people that wanted to be vaccinated, as well as having the opportunity to leave the vaccine in the community with the local public health nurses.
One of the things that I was, I guess, really nervous about, and because I don't come from an Indigenous community, was, when we talk about working with Indigenous communities, this idea of co-leadership, Indigenous autonomy, and community involvement. I think we were trying to do that. I guess my question to you is, do you think we were successful in, I guess, following those principles in the rollout of ORI, and what could we have done better with that? And what are some lessons that you'd like some of our, I guess, listeners to take away from ORI about autonomy, community involvement, and co-leadership?
So I think that's a really important piece in the success for ORI, as well as collaborative efforts in moving healthcare forward and being progressive, is that going to the community leaders first and speaking with elders, because they're going to tell you exactly what they need and exactly how they want it done, and how you can work to make your world connect with theirs to ensure that everything can be done safely, and access to the vaccines or to any type of treatment is there with proper communication and engagement. Visibility is huge in the community, so ensuring that you are visible and that you will come back. And what's really important when you're going into the remote communities is make sure that whatever you say, mean what you say and say what you do, because trust is huge.
And I guess I'm fishing here a little because we continue to work together going into the future because we fly up to your communities. Do you think in developing this trust, will this I guess, how helpful is that for our future ability to work together and work with the communities?
I think it's an excellent opportunity, and I think having that trust established, like being able to work with you prior to our rollouts, was key, and also helped with my confidence in rolling out ORI 1 in collaboration with Ornge and the First Nations. So I think trust is huge, and you don't often have that. So considering that we had that, I would say that that's a huge success.
Okay. And I guess now I'm actually going to switch a bit to, I guess, things that I've always wanted to ask about, I guess, the rollout that I'll take the opportunity. And, as you know, I have a military background. And so when we were doing the logistics and the organization of it, if you remember, there was a lot, we had daily meetings amongst a very large group of stakeholders, and there wasn't a lot of time. And one of the things I worried about was the style by which I ran the meetings, because it was, I was thinking to myself, and there was always a little panic in my head, is that we don't have a lot of time and we've got a lot of stuff to cover. That it was a very, a bit of a militant military style. Okay, this is what we're talking about today. Red Cross, what have you got to say? Ornge, what have you got to say? Ministry of Health, what have you got to say? Was like, do you think Indigenous participants and leaders yourself, were you uncomfortable with that style? Like, did that style, you sort of say, boy, what an asshole he was? Or is there, like, what sort of feedback would you give me about that? Because I was a little nervous about that, but I really had a sense of time pressure.
I too was really nervous about that because for one, in our culture, we're storytellers. So, trying to keep people on time and stick to an agenda is very, very difficult. But also cutting people off when they have something to say is also not a good thing. So, but in this case, because of this type of rollout, I think it was imperative for us to be able to have everybody in the room, capitalize on the amount of time we had together, and identify, the resources and capacities that were in the community, as well as to be able to mitigate the risks in moving forward. So I think it was certainly a style that we needed to ensure success for the meeting, and to keep it to, an hour to a day as opposed to 3 days. So
Okay, so you don't think I was being too harsh, or you'll still continue to talk to me? Okay, well, that's good to hear. Okay.
No, it wasn't harsh, but you had also left the door open, and you gave your availability to say if anybody had any questions or concerns, you would be more than happy to take any calls. So I think that was also a very good approach.
Okay, thank you. And then if you had to think in terms of the actual day-to-day logistics of the running, as you know, we actually had Ornge team leaders as sort of the ground commander, so to speak, of the teams going in. And, you know, from an organizational point of view, it was important for us to have someone in charge on the ground, you know, for vaccine, making sure the vaccine was stored properly, transported properly, to have meals available, like all of the day-to-day logistics. How do you think that there was any tensions between the ground commander and the community coordinator, or was your observation that they worked well? And if they did work well, um, how was it that they were able to work well together?
I think everybody generally worked really well together. We all had the same goal in mind. We all wanted to vaccinate as many people as we could and be able to speak to the community members that were hesitant. So I think we all played a part, and we all naturally had a part or a section that we would play. Whether, you know, we were giving vaccines, somebody was organizing food, somebody was organizing, you know, how are we going to get to the airport? Um, it all just kind of fell into place, and everybody knew each other's role and respected each other's role. And if there was something that needed to be done, we just went to whoever was in the community, and it was done.
One of the things that I was surprised about, and I know you sit at a lot of the leadership tables with the provincial leaders, is I was actually surprised at the level of support that we got to run ORI. It was as if someone in government at a high level said, you know, get it done, whatever it takes. Is that unique in your perspective? I guess in health related affairs with regards to Indigenous communities? And how important do you think that that high level government, um, I guess, decision to prioritize things, how important is that?
I think that was very important and certainly vital and essential in moving forward, because normally First Nations people are not prioritized. You know, we're the last to see. We have disproportionate health outcomes in comparison to the province. So I think it was, you know, an excellent opportunity for the advocacy at the higher level to ensure that First Nations had priority, given our living situations, the logistics of being in a remote community, as well as all of the other social determinants of health and socioeconomic status that we face, and that's unique to First Nations living in remote communities, such as, you know, the overcrowding, the access to water, being able to wash your hands, you know, access to PPE, all of that falls into play.
You know, what you just said reminded me of a conversation I had with, I think it may have been when we were up in, where were we up at?
Peawanuck?
At Peawanuck, in one of in the community, speaking to the chief there, which is, I think in many of the communities at the very first rotations, because we were still looking for doubly vaccinated people, we went to, you know, some of the medical schools for some of the faculty to go up. So there were surgeons, cardiac surgeons, vascular surgeons, and, you know, a lot of the community leaders were laughing, saying this is the first time they've ever seen a cardiac surgeon or a, you know, a transplant surgeon or whatever in their communities. And I think it struck a lot of my colleagues about the fact that there are these communities in our own backyard that have such limited access to healthcare. And I think some of them have reached out to you. Do you think that's a problem with our healthcare system, that like all of these leaders in healthcare really weren't aware of some of the situations, and this was a good eye-opening experience?
I think this was an excellent opportunity and certainly an eye-opening experience for all healthcare leaders, whether they're across the province or country, to see that, you know, we don't have to go far and wide to find health problems. We have more than enough inequities in our own backyard in Northern Ontario, and we're often an oversight. And we figure out, because we're very resilient, we figure out how to get things done and how to do it.
And so what lessons would we take, or would you want us to take out of ORI when we look at other health challenges that your communities face? What lessons can we take, and what structures can we implement to try to solve some of the other challenges that your communities are facing?
So I think just having the knowledge and the opportunity for partnerships and relationships from various medical schools or universities or hospitals in larger centers, that have a lot of services that would be willing to come and do specialized services, or if they want to come up and you can do vaccines and a consult. Just looking at the way we do things as far as enhancing our virtual care capacity. I think that's key, is that having the patient stay at home or receive care at home or as close to home as possible is key to health and outcomes for sure.
So, and I've been, I just realized that I have a phone here that I'm supposed to be monitoring for questions as well. There's too much activity going on here. So a couple of actually great questions related to what we're talking about. Do you think that the trust that has been generated through ORI is sustainable? And can it be used to deliver healthcare during normal times post-COVID? So that trust that we're talking about and then moving forward.
So yeah, I certainly think it is sustainable because we still remain quite visible in all of the communities despite all of the restrictions. So Ornge is constantly in the community. Our team, our WAHA teams are always in the community, as well as our paramedics, to ensure that, not only ORI 1, 2, and 3 are a success, but so is 4, as well as additional follow-up. And then, of course, once we start working on our recovery planning for primary care and public health, et cetera, that we're also present, but also recognizing and appreciating the jurisdictional issues with provincial and federal health jurisdiction, and managing that tightrope, if you will, to what we should be doing, what we shouldn't be doing, and making both of those communities work. What's the reporting system in a provincial public health system is quite different than a federal public health system, and how do we connect those two?
Here's a great question that I've been wondering myself, which is, so I think a lot of the trust is often between people, right? So you and I have worked very closely together with previous Grand Chief Fiddler, with a lot of the different chiefs. Is there a difference between the trust of people between people and that of organizations? And so when you retire, when I retire, how do we, I guess, maintain that trust to move things forward so that it's not just about you and I working well together or so forth, but our organizations working well together to move things forward?
I think you have to build that. Thank you for that question. That's a great question. I think you have to build that relationship from the grassroots. So it's got to not only move from the top down, but the grassroots up, to ensure that there is sustainability and capacity for future relationship and innovation building.
And what, like, how should we do that? Like, I'm thinking about, like, when I'm thinking about my next year's plan, like, does that mean that we should be doing more outreach to your communities, or we should be sending some of our paramedics to chat with your communities, or like, what are sort of things that we can do? Like, I certainly love the idea of having our paramedics working at your hospital, for example, just so that we know some of the healthcare leaders there, so that in the middle of the night when we're trying to move a sick patient, that's not the first time they've met with each other when everyone is stressed and tired. What are some other things that we could do?
I think having an open dialogue, communication, and opportunity to be able to do, continuing medical education, and a collaborative approach, whether, invite our paramedics over or our staff over for CME or a skills blitz, doing that as well as spending time in the communities, I find is key. Even though I'm from there, I find that I often have to be visible in the communities to ensure that I'm understanding the needs of the community, as well as making sure that we're fulfilling our commitment and meeting their needs.
Okay, great. And I know we're running out of time here, but I think as a wrap-up question, and I think this is something that you and I think about, but from the symposium's point of view, there are a lot of young leaders in the audience today that are focused on the future. What lessons have we learned from ORI that can be carried forward when engaging with Indigenous communities?
So I think that no matter how much time you spend in a community or how well you think you know a community, it's always important to get there and to speak to the grassroots people to make sure that you're not offending anybody and that you're getting the information that you need to be able to do your job.
I'm sure that I may have offended someone at some point in ORI. If we if we do that, is there any I guess, how do we deal with those situations? Because you can't be, I think at some point you can't be all things to all people when you're trying to move quickly and do things. Are there any is there any advice that you can give to, and for me in the future, when we're saying something that, you know, the community member might not like, or at least one person may not like, maybe 3 other people like it. What can you advise us in terms of how to manage these types of situations?
So one common thread of, and I wouldn't say it was a negative, aspect to it, but a lot of the communities wanted us to stay in community. They wanted us to stay overnight and be a part of the community as well as feast, because that's a part of our culture. Is to be able to have a big feast and celebrate all of the work that we've done together. And unfortunately, we didn't always have the opportunity to be able to do that, whether it was because we had to move to the next community or the vaccine fragility and stability. You know, there was a lot of factors. So it would have been nice to have more time to be able to celebrate with the communities once we were done our task for the day. So I think that's a huge part and it's a huge part that unfortunately we had to miss.
You know, actually, that was one of my big regrets, and I think that just goes to show that you have to listen to each community. I remember at the beginning, one of the principles that we were asked to try to follow was to not stay in communities because they might be limited in resources, and because they wanted to celebrate, we might be taking resources from those communities. But I think it really goes to show that you really need to speak to the community as opposed to follow a general rule. And I think that's one thing that that I'll take out, is that I think the external teams would have loved to have stayed and feasted with the teams, and we were trying to stick to that principle. But I think we should have played that by ear and talked to each community separately. So thank you. So I think our time is up. So we'll turn it back over to the Reach Alliance.
Thank you so much to Homer and Lynne for an insightful and candid fireside chat. What rang very true for me, and I'm sure many of the folks watching here today, is the importance of community-led initiatives that genuinely include and center the views of the people that are being served by those very initiatives. So we have a break coming up, but before that, we have one last case study to show you about how community-based paralegals in New Delhi and Assam are expanding access to justice to locals there. Let's take a look.